Okay, we're on camera now. So, final for this class is Monday, May 4th in this room from 11 to 1. Okay? Your other options are, if you can't make it at that time, I teach this class at 1 o'clock in the afternoon too, same exact class. So you can come take it during their final time on May 6th from 11 to 1, and that's in room 308, the big lecture hall in the Math Science building on the 6th, that's Wednesday, same time. That's your options. If you want, you can also take it online like the online class does. And the online options are, it opens up Monday night, it opens up Sunday night at midnight, meaning Monday morning at 12 a.m. on the 4th, and it will close midnight on the 7th. So Thursday night at 11:59 p.m., that's when that closes. You will get 2 hours no matter what way you take it. If you take it online, you'll get the 2 hours. If you take it in class, you'll get the 2 hours, okay? The only bonus about taking it in class is you can raise your hand and I can answer questions for you. But if you have questions. But if you'd rather sit at home in the comfort of your recliner and take it, that's perfectly fine. Okay?
How many questions is it?
50.
Are they multiple choice?
It matches exactly what you took for your pretest. Okay. Online is just a little bit different, some of the same questions, but online is the same amount of questions, a little bit different. So you can do it online, you can do it here. If you prefer the online format, but want to be able to ask questions, if you're connected to the Wi-Fi here, that's fine. You can show up with your computer and do it right here online, and submit it online and ask questions here. Okay? So I'm very flexible with the final for this class. Yes?
But if you close out of it, you're done.
You're done.
So how could you come in and ask the question? You'd have to leave.
If you had a laptop, like I had somebody last year bring their laptop with them to the final, and they did the online final while sitting here with me and asked questions occasionally. And so, but the majority of the people that took it in the classroom took it as a written.
Paper. Yeah.
So it'll be the same format I gave you your pretest. You have to have a piece of paper, pencil, a calculator, and that's it. Oh, and your conversion sheet. You can have your conversion sheet, a blank conversion sheet. So I might print out conversion sheets that are blank just so you guys can have a conversion sheet. So other than that, not much new coming your way. Today our lecture is on pediatrics, and ultimately it is pretty much the same information as last week. It's just a pediatric component to it, kind of eyeballing things because we work a little bit more with micrograms with the pediatric population. Are there any questions about last week's homework that we need to do on the board? Anybody? Don't have to raise your hand at once.
Your office hours this week are what?
My office hours this week are unchanged. So I will be in my office today from 3 to 4, and I'll be in office tomorrow from 2 to 4. Okay, those are my guaranteed office hours. But I will be in my office today till 5 at least.
Okay.
You can guarantee to catch me there from 3 to 4 because that's my scheduled office hours. But I'm staying a little later today. And then tomorrow I should be in my office till 5 also.
Till 5. And Thursday not?
Thursday I don't have any scheduled office hours, but I usually come in around 10.
Okay.
And then I
stay until about 4. So, the scheduled office hours are the mandatory office hours that no matter what, I sit at my desk and I sit there, even if I have nothing to do, I sit in my office during those hours because that's what's required of me from the college, to make sure I'm available for you guys at certain times.
Okay.
So, or you can make an appointment and just come see me too. We can make that happen too. So. Anyways, if you are taking it online and you decide you want to do it online, it does not have to be proctored. I say that right now because I just had a student email me right now saying, I'm an online class for your math for meds, do I have to get it proctored? No, you don't. So all I can say is, if you're doing it online, you're not supposed to use the book. That's all I can say. So, if you're doing it online, at home, just, you're not supposed to use the book. But you're not being proctored. So, anyways.
You had 3 students from your online show up Saturday.
Yeah, that's what I heard. Yeah. Was that a good turnout on Saturday?
Yeah, that's quite a
Yes, I was the runner. I walked 10 miles and been hungry all day.
Barbara was there, I was there.
I was laying on the floor for 8 days.
Really?
He was there.
Good. Good, I'm glad. So no need help with homework, everybody's just acing it, doing good? We have some honesty in the back. I haven't even done it. What's that?
Isn't it combined 25?
Yeah.
But you know,
So after today, I'm guessing I'll have a lot more questions.
Yes.
when I did 21 and 22 and just literally failed the test, I haven't been anxious to try again.
Alright.
So I'm not really sure what I missed on them, so I can't really tell you. I don't know.
Okay.
Will you also go to our homework for chapter 23 to 25 and just maybe go over some of those? We don't know. We haven't gotten our grades back yet, so.
Yeah, and I'll be grading. I'm going to be grading like crazy for the next couple days, just trying to make sure you guys have an accurate idea of where you're at and have all the feedback you need before the final. So, and I apologize. This whole time I thought that I haven't been making many comments on your homework because I thought that the answers, my little answer, because I have a little thing, correct answer, that's supposed to pop up when you hit submit, and it tells you, oh, they weren't there, and I didn't know that. So I had the students in, like, go, hey, all you put on my homework was good job. Can you give me some feedback? And I text back, I emailed him back. I'm like, oh, how about you read the homework? You know, it's on there. He's like, no, it's not. I'm like, oh. So in the middle of this email, Justin was sitting there doing his homework on one of the computers in my office. I'm like, oh, hey, pull up your homework really quick. And he's like, okay. And he pulls it up. I'm like, oh, my bad. I thought this whole time I went in and some of the assignments weren't clicked to allow you to see the comments. And so this whole time I thought you guys were getting feedback from me and you weren't. So I apologize to anybody that was wondering what the heck. So if you have questions, make sure you ask them. And if it doesn't show up, because I thought I went through all the assignments and thought I fixed that, but if it doesn't show any of the correct answers on the essay questions after I've sent it back to you, give me a what's up so I can fix it on the assignment. Because every assignment's a little bit different. And it's one little tiny checkbox, and if it goes by, if you don't click it, it doesn't, you actually have to physically click it. It's not an automatic setting. So, okay, so let me know if something doesn't show up or if you need feedback, and I'll help you out. I know there's a couple of my other class will email my regular email, they'll just cut and paste the picture and say, hey, help me out with number 25. And so I'll immediately, like with my phone, even half the time, say this is how I would do it, and then I'll email it back to them. So if you want that kind of feedback, that's fine too, what if you're doing the assignment, if you're in the middle of it. Just cut and paste the picture, throw it on email, send it to my taz.brickeroff@eac.edu, and it goes straight to my phone, and most of the time I'll be able to respond pretty quick, unless I'm flying. If I'm flying, like actual in the act of flying, I usually don't answer emails for about 3 hours. So, okay. And if I am flying, I'll give you a heads up and say, hey, I'm in the middle of flying. I'll get back to you shortly. So, for these last couple weeks, these math concepts are a little bit harder, and people tend to stress a little bit more about them. So, I'll be there as much as I can. So, anyways.
Do you have any idea where we are
Where we are right now?
in this book?
Chapter 25 today.
I know they're pediatric, right?
Pediatrics.
Yeah, that starts on. Determining whether an IV dose is safe for children.
Pretty much. Pretty easy. So, reminder. All the modules, or actually all the homework assignments, will close on the 1st, this Friday at 11:59 p.m. The ability to do your assignments will end at that time. So make sure that you have your homework done by that time. That goes for all sections of this class. That goes for you guys, that goes for my 1 o'clock class, that goes for my online class. What will be available is all the PowerPoints and the lectures still. I will leave those up all the way until next week. I'll close it with the final. So lectures and PowerPoints will be available to go through, but all your assignments will disappear on the 1st. Okay? So that gives you the ability to review and do whatever you want to do. You can use those. If you notice, we've kind of spent more emphasis on these last several chapters because those are the most important chapters for your final. But I will upload a final review, some concepts to cover. I'll look through your final today and just kind of put a Word document available on the last module that will just say, hey, make sure you cover this concept, cover this concept, cover this concept, so that you have a better idea for the final. But if you're doing okay on the homework now, you'll do fine. Okay? I wouldn't worry about it. Doesn't mean don't study, just don't stress. So, okie dokie. Where are you at? Chapter 23, 24, there we go. This old archaic button push thing here, it's actually got buttons, not touch screen. And if you don't push it in the right order, it takes forever to get it to boot it up, and I just pushed it in the wrong order, so it's going to be the same. There we go. So, this is the last time I probably will see all of you together, right? Because some of you will probably decide to take it at home, and some of you probably come take it in class. But it's been fun. I've enjoyed this semester. HCE116, all my sections are some of my funnest classes, even though it's just math. But it just seems like you guys tend to interact more than some of the other classes. So all these sections are a good time. So it's been fun. Hope that you guys have enjoyed this class. I hope that I've taught you something. Before I forget, make sure you go on and do your course evaluation. That's just easy extra credit points that you're throwing down the drain if you don't do them. If you do them, make sure that you still complete that assignment on web study so I can give you
points for it. If you don't complete the assignment, if you just email me a copy of your print screen from doing the eval, I still need you just to go on to the assignment in the tab in the timeline and just finish it. Just submit and put in the text box, I did it. Okay, and send it out, okay? That way it makes it way easy for me to say 3 points. If I don't, then I have to go in. It takes way more extra steps for me to do that. So to give you credit for it. So just submit the assignment and then it's quick and easy for both of us.
And you're gonna download a review for us, you said?
Yes, I'll put online a little Word document to give you some ideas that what you need to review. So
And when will that be available?
I will go through, my grading is my #1 priority because I really want to have everything done that when it closes at 11:59, that most people will have their grades and know where they're at. So unless they're a really bad procrastinator, I spent a lot of time on spring break last time, but which is fine. I set the due dates for a reason. But anyways, so that's my #1 priority. So I'm hoping to have it to you guys, something on there by Wednesday afternoon.
Okay.
Are you talking about just needing help knowing what's gonna be on there?
Yeah, I'm gonna go through the final, and I'm just gonna kind of put some concepts on it to make sure that you review and understand, so that way you know what you're up against. So. I won't put any questions on there though. I'll just mention, hey, this concept, there's this many questions, make sure you review it. We have this fancy thing called a book that has a lot of available questions in there that you can, so once I give you the concepts, you should be able to go to the book, look them up, and just do some practice, okay? All right, so pediatric and adult dosage calculation based on weight. We did some of this last week because that's part of a big chunk of the critical care calculations is weight-based calculations, okay? So even the PowerPoint knows that. It's pretty straightforward. There's just gonna be some review. The only addition is body surface area, but we don't really even calculate body surface area. And I'll be honest with you, body surface area is rarely used because the weight-based method tends to work just as good, and it's a lot easier, and I can do that math. I don't have to have a fancy chart to tell me what the body surface area is based off of this height and weight and blah, 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 okay? So there's a lot of things that we can do that work just as good and make it easier for us to do things, So pediatric calculations based on weight. The reason we do things based on weight is that way we don't overdose our patients, because every patient's size will tell us what the appropriate dosage is for that patient to metabolize it correctly. So since there's math involved, guess what? Error rate in children calculations or pediatric math is some of the highest incidences, mistakes for medication errors, because guess what's involved? Us, the provider, doing the math, right? So our math needs to be accurate. It's 3 times higher in children than it is in adults, okay? And there's a lot of confusion between adult and pediatric formulations. Is this a pediatric dose? Is this an adult dose? And most medications now are kind of calculated if it's an adult dose and it's a weight based, that weight based, if it's weight based, can work for the pediatric population too. But if some medications we use are just adult only, okay? Oral liquids available in multiple pediatric strengths. One that comes to mind is like amoxicillin. You can get it in 125 per 5. You can get it in 250 per 5. You can get it in 400 milligrams per 5 mLs, okay? And that would create math for every time you give it if you're using different concentrations. Sometimes we are the people that cause the error most of the time, whether it be the math or we do the dilution wrong. If we don't add the right amount of mLs and we come out with the wrong concentration,
We give them the right amount of mLs per our math, but if we have the wrong concentration in the first place, we can overdose or underdose our patients. Look-alike packaging and look-alike names, sound-alikes. I told you my stories about close call med errors based off of just the way the package looked. I told you about my med error where I actually committed a med error based off how the package looked at a quick glance emergency situation. So it happens. There's that other factor too of the pediatric patient. When we send them home, guess what? Who's dosing them? Mom and dad, right? Or a guardian. So if we don't educate them correctly, we can unknowingly cause an overdose situation at home because of the parents. Calculation errors, we talked about that a little bit. And errors in measuring devices, you know. We're trying to, you know, not everybody knows what 5 mLs is, but everybody knows what a teaspoon is. But teaspoons aren't calibrated as good as the things that are measured in mLs, right? So there's this fluctuation in accuracy of devices. And so that's why it's kind of scary. That's why we tell them to use what's given to them. You know, if it's a dropper that's specifically calibrated for that medicine, then use that dropper, right? But those are some of the things that cause errors with pediatric population. I have a form on the board on the timeline that you guys have been doing. I've been seeing some interaction on there. One of the common people mention every once in a while is they wish that I would get on there and comment on things. And I set up those forums for you guys to work with each other and comment and kind of interact with each other. And it kind of gives me an idea of where you're at on your thought process. Some things that come, always remember when I read them though is, it's really easy for us to get on there and play, you know, what's the Monday morning quarterback? And so always remember that there's going to be a time in your life where you're that tired nurse that's falling asleep at the counter. I'm not going to lie, I was working one night and I thought I was awake, and then I turned around and everybody's laughing. I'm like, why is everybody laughing? And next thing I know, my coworker had recorded me going bobbing my head, you know, and I didn't even know I was doing it. And, you know, and they thought it was hilarious and everything like that, you know. But there's those times when you're going to be starting out as a brand new nurse, and guess what? The first shifts that come available for hire are night shifts, because anybody who has seniority is ready to sleep at night and work during the day like the rest of the world. So, you know, just remember that, you know, there's going to be times where you're going to need somebody else's sympathy, and there's going to be those times that you're going to be tired and you're going to remember some of these things like, oh. So it wasn't that that nurse was a screw up. She was just really tired. She probably worked too many shifts. She probably did this.
She worked too many shifts.
So you just have to remember that you will be there one day. Now, I hope you're not the one that's ever throwing pills at the patient's mouth. Right, bouncing it off their forehead. Ooh, pick it up off the ground. 5-second roll, putting it back in. But just remember, you know, you guys will be those new people or be there at someone's mercy saying, holy crap, I messed up. Okay? Knock on wood, hopefully you never have one of those errors in your life. But I can guarantee you now, there's going to be that possibility that one day you're going to mess something up. Is it going to end in patient harm? Hope not. Hope it's one of those like, oh, whew, you know, that could have been really bad situations, okay, but it wasn't really bad. Or, you know, I've told you, I have friends that have killed patients before with medication errors.
Well, we watched that one video of the nurse that killed herself.
Yeah. Yeah, she couldn't live with herself, and the whole fact that she got fired for med error ruined her career. You know, in her eyes, life was over. So, just remember that. You know, my comments now here on the forum, now that we're at the end of the semester, that, you know, it's good to see your feedback. And some of you guys actually say that. You know, it's hard to say with us being in her place, blah blah blah. And some are like, "Oh, burn her at the stake, hang her, drown her." Tie ropes to her anchor, throw in the ball, and see what happens. She floated, she's a witch, kill her. You know? Salem witch trials. Anyways, so just remember that there's going to be a day, one day, where you're like, oh my gosh, that just happened. So
Part of our thing with doing medication based off of weight, there's an extra figure in there. And so we have to make sure that after we do our math, that we make sure our dosage is safe. Most drug books will show a safe dose range for medications when it comes to the pediatric dosing. And I'll also mention things for adult dosing also. And with the adult dosing, it will say not to exceed this amount per day. So anything in this range is okay, don't exceed this amount. With the pediatric population, it'll always have the weight component, so not to exceed this many milligrams per kilogram per day. So it's that's the extra part of the pediatric dosing, is deciding, is it safe? Body surface area is a critical value, but most of the trend is now just heading to weight-based. You know, some of the pharmacy calculations that they use for pharmacy tech and in the pharmacy use body surface area, but primarily most everybody's heading towards a kilogram per weight dosage. Just remember, physiological capabilities of the pediatric patient are different than infants, and different in children, and different in adults, based off of maturity of the organs that are metabolizing those medications. So make sure you just adhere to the pediatric guidelines and use your references, because even on the pediatric references, it will even say age group from 0 to 5, from 5 to 12, you know, and on up. And even changes with the medication. Some medications say from 0 to 6 months, from 6 months to 4 years. It has different ranges based off of the medication. So make sure you get a reputable reference when it comes time. And if you decide to do nursing, they'll tell you exactly what book they want you to have and what book to refer to and those kinds of things. Just remember, when you're doing body weight and body surface area calculations, that you round to the tenths. And that's 1 decimal place, okay? I still are getting a couple of them where we're rounding to the wrong decimal place, okay? But remember, it is the nurse's responsibility to verify before giving, okay? Because you are the last line of defense in medication errors. And I've seen it more than once where it's made it from the doctor to the pharmacist, to the pharm tech, to the nurse, and the nurse catches it right before they give it to the patient. Holy cow, this is too much. And then they call the pharmacist says, oh my gosh, that's too much. You call the doctor, hey, we need to change this order. And the doctor says, I ordered that? Oh my gosh, that's too much. So just remember that. We are the last line of defense. So when it comes to pediatric calculations, there's really not much new that you're going to learn today other than some body surface area calculations, because we use the same methods, whether it be ratio and proportion, dimensional analysis, formula method, whatever you've learned that sticks, that works for you to make sure you get the right answer every time. Just remember, with pediatric doses, they're a lot smaller in volume and usually smaller in dose, like in micrograms instead of milligrams, because we're that small of a dose. Those IM doses are very small. We don't have as much muscular tone at that age in the pediatric population, so most of the time you're not going to have a shot that's over 1 ml. And in the infant size, you're not going to have anything over 0.5 mLs because they don't have a lot of muscle to absorb those doses. And sub-Q doses are not to exceed 0.5 mLs for the pediatric population. Okay. So we use the TB syringes a lot. So if dosage is less than 1 ml. What can we round to on the mLs?
The hundreds.
To the hundreds. Right?
That's if we use 1.
Any volume less than 1 ml, we can use a TB syringe, which is accurate out to the 100th of an ml. That's 2 decimal places, okay? Just make sure all answers need to be labeled, okay? So just a reminder, if you didn't remember that 2.2 pounds is 1 kilogram, this is the math showing you how to figure that out. Just remember that you need to round it to the tenths. Do I need to do this on the board to remind you how to do 2.2 pounds per kilogram, or 1 kilogram is 2.2 pounds? Most of the time, it's going to be from pounds to kilograms, yes.
So do you want us to round to the tenths? Unless it says otherwise?
Unless it says otherwise, for body weight.
Okay.
For body weight to the tenths, okay? So, since we're in America, remember, and we're still one of the few countries that use pounds, that's why we're going to be doing pounds to kilograms a lot. We rarely go the other direction.
little extra here when you have those babies that have ounces in there. We have to convert those. So just remember that there's 16 ounces is a pound, and so 6 ounces is the same as 6/16 of a pound, right? We talked about that a little bit previously. So 6/16 of a pound, 6 divided by 16 is 0.37, so we would round that to the 4, to the 10th, so 0.4, so it'd be 14.4 pounds. Okay. Pretty easy peasy, just some reminders. If we were doing dimensional analysis, this is how we would do it the rest of the way, because we have 14.4 pounds. We're going to convert that to kilograms now, which is 6.5 kilograms. Just a lot of review here. You remember how to do that. Just remember, if it's in ounces, you take the ounces portion, divided by 16, and that decimal point, you add it to the pounds that you already have. Okay? And then you just do the regular amount of 14.4 pounds, or whatever those pounds are, to convert it the rest of the way into kilograms. Because our conversion factor of 2.2 pounds per kilogram doesn't have any ounces included in it. So that's why we have to do it to pounds first. Grams to kilograms. So, with the neonate patient, they are still weighed in grams because some of the time they don't even weigh a full kilo almost. They're tiny, 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 tiny. My wife's on this birth plan app. It's like Facebook for pregnant women. Anyways, she's made some friends on there that have the same due date as her, and one of them delivered this last weekend. And she was 23 weeks. And the baby was like a pound.
Wow.
In the NICU. 23 weeks is the youngest. The youngest age that the fetus is considered viable, and they'll keep the baby. If it's less than 22 weeks, a lot of times they let the baby go because it's not really compatible with life for that. So anyways, the baby's in the NICU, but weighs like a pound. That's less than a kilo, right? So grams is what they use, but you have to make sure that when we do pediatric doses, guess what they're going to be in? They're going to be in kilograms, right? A dose, because it's a pediatric dose. So we have to know the difference between grams and kilograms. And that's pretty much 3 decimal places, right? So if I'm 3,000 grams, I can move my decimal place 3 places to the left and get 3 kilograms for a pediatric, for an infant's weight, okay? Here's to do dimensional analysis, starting with my 3,000, 1,000 on the bottom, 1 kilogram on top. The book shows dimensional analysis in reverse of what I do, but either way, this is a lot of review. Okay. So now we're getting to the meat of the lesson. Okay. So calculating pediatric dosage in milligrams per kilogram per day, or milligrams per pound per day. So we have to figure out a daily dosage. So sometimes what we'll get is we'll get an order that says this dose Q8 hours. And then you'll get a response with the safe dose ranges per day. So then we're going to have to figure out the math to see what the total dose per day is to compare it to our book, our reference point, and those kinds of things. So let's look here. Just make sure that you use the recommended dosage from a reputable source. You take into account that if, let's say, I have something 30 milligrams Q8 hours, how many times am I giving that in a day? 3 times. So actually, my dose per day would be 90 milligrams per day, right? So we rarely give just a per day dose to a pediatric population. Most of the time, it's immediate release and over smaller dose increments. And just remember, there's high and low dose ranges of recommended orders, so make sure that you stick to those if it comes to safe doses. So here's one. Dilatin, 30 milligrams POQ 8 hours. The child weighs 80 kilograms. The recommended dosage is 5 milligrams per kilogram per day in 2 or 3 equally divided doses. Is this a safe dose?
It's 18 kilograms. You said 80 kilograms.
Did I?
Yes.
I'm glad we all can read. Say, what is that? Do what I say, not what I do. Or something. Anyways, so the child weighs 18 kilograms. Okay, so I would take my 18 and multiply it by 5, right?
90.
18 times 5 is 90. So right now my patient is getting a 90 milligrams per day is the limit. That's the recommended dosage based off of the 18 kilograms and the 5 milligrams per kilogram per day. Okay? So that's my 90. All right. What's my order?
30.
30 milligrams.
3 times.
And they're getting it Q8 hours or 3 times a day. And remember, 24 divided by your Q whatever hour is going to give you your how many times you're giving it that day. So 24 divided by 8 is 3. 3 times 30. So the patient's getting 90 milligrams a day, and the recommended dosage range is 90 milligrams per day. Are we safe?
Yes.
You guys are already on.
30 plus 30 isn't right.
So how many capsules are they going to get per dose?
3. Or one
One.
capsule.
Per dose. Make sure you pay attention to that. Some of the math that's getting wrong on these assignments is it's asking for per dose and you're giving per day doses or day amount, or if it's asking per day and you're just giving me the dose amount. So make sure you pay attention to what the question's asking. So adult doses based on body weight, guess what? It's a lot of the same math, right? So let's do this one. Tycar, which is ticarcillin, 4 grams, IVQ 6 hours. Client weighs 175 pounds. Recommended dose is 200 to 300 milligrams per kilogram per day, given in divided doses every 4 to 6 hours. Is this dosage safe? Okay. So the order is for 4 grams. Patient weight.
79.
What's 175 divided by 2.2?
79.5.
79.5
That's already rounded.
to the kilograms, all right? So this thing, we're at 79.5 kilograms, okay? What's my recommended dosage?
200 to 300 milligrams per kilogram per day.
Um,
2 to
200 to 300
Mm-hmm.
milligrams per kilogram per day. Okay, so this is a multiple step problem. 200 times 79.5 equals
15,900.
2,000 times 79.5 is what?
15,900. 15.
900. 15.9 grams. Okay, so 200, because it's 200 milligrams per kilogram, so 200, I'm substituting the kilograms for the actual weight of the patient. So this is the low dose range. 200 times 79.5 is 15.9 grams per day. Okay, what's 300?
23,850.
23,850.
Yeah.
Right. .85 grams per day of dose, right? Okay, so what's ordered? This is our safe dose range. It's behind that, huh? 4 grams times what?
79.5.
This is our order. We don't time. We're timing it by how many times it's given, because it's not given to us in a weight base at first for the adult population. 4 grams is usually a safe dose just to give to anybody that's an adult.
That's normal functioning system. So 4 grams times what?
6 hours.
Q6, so times 4.
Yeah. It's 240.
So they're getting 16 grams a day. Is that safe?
Yes.
Okay. Does that make sense? So with the adult population, sometimes you just get a set order that doesn't require you to figure out the dose. With the pediatric population, most of the time it's given in a dose per milligrams per kilogram dose that you figure out the dose. Okay? 16 grams per day is what the patient's getting, yes.
Quick question. If it was done every 4 hours, would it not be safe since it's 24?
Right. It would be kind of above it would be above the dose range.
Okay.
So I was just getting ready to ask that question. What if my patient was, this is the antibiotic that my organism that I'm fighting is susceptible to, but it's not effective quite yet because I'm not in the right dose range, and I increase it. Could I increase it to Q4? No, I couldn't, right? Because it would be too much for the patient. Because sometimes we'll do that. We'll increase the amount that the patient's getting over a certain time. Okay. Usually it says if the dose within 10% variance of the low range, we can give it. Okay. So based on what's available. So if I did the math for a dosage range of 49 point, and it comes out to 49.5 milligrams, and my tablets available is 50 milligram tablets. Is it okay for me to give that? Yes, because that's what's available, and it's within the 10% range. Okay, so this would be really close to be within the 10% range. So I would definitely be doing some math to figure that. Okay, so body surface area. Turn the camera back. So body surface area, we use charts to do that. Honestly, the main time that we use body surface area, the only time that I've used body surface area in my nursing career is in the intensive care unit. We use body surface area a lot for hemodynamic calculations, cardiac output, stroke volume, cardiac index, those kinds of things is the time that we use body surface area a lot, okay? Other than that, I've never used it in my career as a nurse for medication calculations.
The only reason I could think of body surface area is for burns.
Burns, body surface areas we use for burns a lot, but primarily body surface area for any calculations primarily is in the ICU setting. So we'll look at this. It depends on where you are and what book you have. You'll get different charts that have just a little bit different body surface area calculations. The one that we recognize the best here in the U.S. is the West nomogram for body surface area. Okay. So here's the nomogram. Okay.
It's on page 667.
So we have height in inches and centimeters. Okay. And then you can, using a ruler, you can go across and line up your weight. That line that it makes, we'll get there, will be your body surface area, okay? Body surface area usually can be rounded by weight alone, but it is way more accurate if you have a height with it, okay? So this gives you, when you use it like that, you can kind of see if I'm 70-pound child, I'm going to be kind of close to this weight of, or height of 90 centimeters, right? But not all kids are made different. My little girl is in gymnastics. She's pretty muscular, and so she's
this tall, but she weighs 80 plus pounds, right? She's a little brick house. You know, she comes to the gym with me in the mornings. You know, she likes to do all the fun stuff. But is her body surface area going to be the same as somebody else's? No. Okay. So when you have abnormal height and weight, this is how you use it. We use it for children and small adults. You start on the far left and you go to the right of the nomogram. Okay. Make sure you use a straight edge. Centimeters or inches don't matter. Depends on what weight you have. So if I am using this nomogram and all I know is that I have height in inches, then I'm going to make sure that I use pounds on the nomogram. That makes sense? So if you're going to use the same unit of measure, whatever one you're using. So let's look at it. So I'm normal height and weight. My daughter would fit in there, right? So first, I'm going to start with how tall, by how much they weigh, use my straight edge and see where that line intersects. And there's my body surface area. Okay? Can you see why we don't use this all the time?
Yeah.
Yeah. Kind of
Okay.
confusing.
So, height, then weight, mark it on your sheet, straight edge it, and where that line, that straight edge line intersects the body surface area, which is right here, that is your body surface area. Okay? In meters squared.
Wow.
So, probably part of the reason I have never seen it is because I've never worked with chemotherapy for pediatric heart patients. Very, very rarely used even in the critical care setting, other than, you know, because we just use the per kilogram, which is based off the patient weight. Okay. Make sure you just use the formulator and calculator that can do things to the square root, because you have meters squared on there. And it's all based on measurements that you obtain and use the nomogram. Okay? That's why they save it for last. I don't know why we really even cover this very much, but it's part of your course design that you learn this information. So make sure that you don't mix formulas. Preference is metric, because everything's going to be metric. Okay, milligrams, grams, those kinds of things. Your medication is not going to come in anything other than metric. So if you can use centimeters for height and kilograms for weight, that's going to be more accurate. Okay. And don't use household units. Okay. So formulating for calculating your own BSA. So you have to multiply your weight in kilograms by the height in centimeters, and then divide the product by 3,600. Okay. I don't remember seeing any of this on your final.
Thank you.
So, just saying.
Just a thought.
Just a thought. Okay. Once you've done that, and you've done the height in centimeters by the kilograms and divided by 3,600, then you hit the square root sign on your calculator, and that is your final body surface area in meters squared. Make sure you round it to the nearest hundred. Okay. So let's do one on the board. I don't have a square root calculator on me. Nope, that looks like important stuff to write. Okay. All right. Let's do one. Let's talk about pediatric. Let's talk. Anybody know their kids' height and weight? No. Anybody have kids? Actually, there's only a couple of us in here. What's that?
My daughter weighs 128.
128. She's 128 pounds. And how tall is she?
I want to say 4'11".
What's that? 4'11". 4 foot 11 inches. Okay. So let's convert those first.
So,
It's 59 inches.
And a boy.
59 inches,
So 59.
59 inches.
149.8 centimeters.
Okay.
0.86.
So what is it?
149.86.
So that's centimeters, right?
Yeah.
So that's the first part of it. 49.86 centimeters. Okay. Now we need the kilograms. 128 divided by 2.2. 58.2 kilograms. Okay.
8,719.12.
149.86 times 58.2 divided by 3,600 equals. Hold on. This calculator doesn't like me. So it's not me. It's not me.
No,
We're
not at all.
just using around the top too.
Divided by. So 2.42, right? And then I square root that. So my body surface area, 1.56 meters squared.
So is this gonna be in our homework online, but not on the final then?
I don't recall it being much on your homework. I think there's one or two, but the body surface area is just part of the math, not you figuring it out. Okay.
That won't be on the final, right?
You won't have to figure out somebody's body surface area for the final.
Thank you.
Now there might be a per meter squared, meaning you would just treat it like kilograms and you would multiply it just like anything else. But you won't be figuring out like this somebody's body surface area. So here's the formula. BSA equals weight in kilograms times height in centimeters divided by 3,600 square rooted. Square rooted. Or you can say body surface area equals the square root of weight in kilograms times height in centimeters divided by 3,600. Either or. Tomato, tomato, right? Don't worry about doing pounds and inches. Just convert it and use the 3,600. Because this is just body surface area if you're doing it meters squared, weight in pounds and weight in inches. So the only difference there is you just divide it by 3131. Just do the conversion and do it with kilograms in the first place. So. This is a trick if you want to try to figure out how to do, if I have an adult dose of medication, like that's common, okay? Using body surface area, I can kind of figure out what a roundabout pediatric dose will be based off of an average adult dose, okay? So if I ordered a medication for an adult that's usually 125 milligrams, using body surface area, we would try to figure out a dose for the child that has a body surface area of 1.4. So all we do is we just take the body surface area of the child that we have. So that goes on top. So we know that the body surface area is 1.4. We divide it by 1.7, which is the average adult dosage, average adult body surface area. Multiply that. Pretty much what we're doing is we're getting a percentage, right? This pediatric patient of 1.4 is so many percent of this weight, right? And we're taking that percentage and we're multiplying it by the dose of prescribed adult, okay? So let's do one of those really quick.
The task,
Yes.
you said that that's not gonna be on the final most likely, but is it in our homework and the exam and stuff?
There is some body surface area, but it's primarily not this. It's just kind of like per surface area per meter squared, kind of just like your per kilograms. Okay. So, but I'll lecture this. If you have questions, if anything arises on the homework or the final, make sure. But this is not of highest priority. Can I say it like that?
Fantastic, yeah.
Okay. So, let's say I have a pediatric patient that is, what was the one we just did?
128.
So 1.56 meters squared, was it, right?
Mm-hmm.
That was 1.56 meters squared. We know we have an order for 100 milligrams of low pressure. Is the adult dose. What's going to be my pediatric dose? .56 divided by 1.7 times 100 equals body surface area of the actual child that we were worried about divided by 1.7 times 100. 91.8 milligrams would be the appropriate dose of low pressure for this pediatric patient. Okay? Or what you can do is when you look up the safe dose range for your pediatric patient, you can just see what the normal dose is for the pediatric patient, so many milligrams per kilogram, and do the math that way, figure out what the right dose is. Just me. So IV therapy for children, okay? We are very specific on what we use for them, like I mentioned, on their age of development, for their organs, of the ones, especially the ones that are metabolizing the medications that we're giving. Just remember, use micro drip when you're dealing with the pediatric population so you can calculate accurately if you have to use the drips per minute formula. But the best is electronic devices, aka IV pumps that we use every day in the hospital setting. So secondary infusions go in through a IV piggyback or in a burette. That's a calibrated chamber. Did I bring that in? The thing that you can fill up and mix inside the IV tubing itself. Just remember, if you do use that and you're also infusing your IV fluids through that same burette, that you just flush the line after you're done so the patient gets all the medication. Okay. But number one, and this is the safe answer, check your protocol for all IV infusion rules, okay? Because every hospital is a little bit different. We've had patients come from we've had nurses come from other facilities that have worked actual pediatrics. And when we tell them, hey, you gotta use a burette, they're like, for what? We use burettes with all our pediatric patients. That's institutional policy. And they say, okay, that's the rule, that's how it is. So, that's the burette I was talking about. You can do all your medication mixing right here. This has an injection port, so you can take your antibiotic, squirt it in there, and then add the fluid to this right chamber level, and then you can infuse your medication right there. Okay. So, drop factor 60 drops per ml. Nothing has changed. This is drops per minute. We know how to do this, right?
this is a quick method for drops per minute. You can take your total volume, multiply it by your drop factor, and that will be your time, with the time of minutes you need underneath. So let's say I need to infuse something in 30 minutes, and it's 100 mLs, okay? So I would take 100 times 60, okay, that's my drop factor, and divide it by 30, so how many drops per minute will that be? 200.
Yeah.
Okay? That's how long it will take you to infuse, okay? If I wanted to infuse it in that time frame. That's all that is, because when we do IV piggybacks, they're rarely over an hour long. Most of the time they're between 30 minutes to an hour. So that's how I would figure out my drops per minute. Okay? Or you can use dimensional analysis to do the same exact thing. I want you guys to write that down if you want. This is just to figure out how many drops per minute to infuse a set volume over your desired minutes. Okay? Yes?
Can you tell us or show us real quick the dimensional analysis?
Yeah.
That's up there.
So I have,
Drop factor 60.
so I have my 100 mLs, and I want to infuse it in 30 minutes. Okay? Remember, like when we do any time conversion, like if I wanted an mLs per hour or anything like that, I can use this. This is the method I would use if I was trying to figure out mLs per hour even. Okay? So 100 mLs in 30 minutes. And then I have 60 drops for 1 ml. So now I'm ready to go, because I'm in drips per minute now. Drips per minute. So 100 times 60 divided by 30.
200.
600 over 30 equals 200.
Okay. What if I was trying to figure out mLs per hour to put that same thing into my pump?
100 ml.
So I start with the same thing. 100
Yes.
mLs per 30 minutes. 60 minutes and 1 hour. Minutes cancel out. 100 times 60 divided by 30 gives me 200 mLs per hour. So that's what I could program into my pump. Okay. This is actually very common math because you will get IV piggyback orders that will just say infuse over 30 minutes. Then you have to look at it and say, oh look, this IV piggyback has 150 mLs in it, and I need to infuse it over 30 minutes. 60 minutes, 1 hour. So this is useful math right here, because you will use this for sure if you go into nursing. Okay? So 150 times 60 divided by 30. I told somebody's calculator. So 300. So I would plug into my pump 300 mLs per hour, okay? So you take you have your volume over time, right? What is this? That's a volume over time, is it not? Okay, so we're just changing those times, converting it to a different formula, okay? Or for a different form. So this is actually commonly used. Not so much in the drips per minute. Drips per minutes are nice to know for just emergency purposes.
So. We can do this one on the board right now. Antibiotic of 100 milligrams and 2 mLs, dilute in 20 mLs to infuse over 30 minutes. 15 ml flush to follow. Okay, so I would have the 2 mLs. I want a final concentration of 100 milligrams and 20 mLs, right? That's the final concentration. So how many mLs am I going to add to that? Am I going to add 20? No, because that would give me 22. So I would add 18 to have a total volume of 20 because of the 2 mLs that my IV antibiotic already has. 100 milligram and 2 mLs to be in a total of 20. So 18 mLs is what I add, okay? Because the 2 mLs of the medication. So how are we going to do this for the flow rate? Okay, we're going to do this total volume of 20 mLs over 30 minutes, right? So I'll go back to dimensional analysis. $20 mLs in 30 minutes with my drop factor of 60 G drops per minute for 1 ml. So 20 times 60 divided by 30. Let's see,
1200 divided by 30 is 4.
was it 20 times 60 divided by 30?
40.
240?
40.
40.
40 drops per minute, because that's what's left, drops per minute. Okay. So for oral medications, the dosage are, of course, are smaller, and the volumes will be smaller. Okay, we don't want to make kids gulp down tons of medication, especially if they're already sick. They probably don't feel like gulping down anything, right? Most medications for the child population are liquid, and oral route is preferred to parenteral. Why? Anybody know?
Oh gosh, their little veins are so skinny.
Yeah, so we have to poke the patient, right? Whether it be an IM injection or an IV injection. They're already probably getting poked for labs and all those kinds of things in the hospital setting, so we're already torturing the kid, especially if they can swallow it. And half of the medications we give the pediatric population are almost as effective from an oral route. So why would we torture a kid if we don't have to, right?
Right.
Plus, the math involved for the IV route medications is more complex and has more room for error. Okay, so pediatric population just does better with oral medications. Okay. Any questions? So body surface area, it's not the end of the world. Don't kill yourself trying to remember or learn it. Okay? But now you have been lectured on 23 through 25, and you will be able to do your math, your homework. Okay? If you have any questions whatsoever, make sure you let me know. Either shoot me an email. You know what? Right now I'm in web study. This week I'm going to be in the web study a ton. So you'll probably get the same response time frame unless it's after 5 p.m. After 5 p.m., if you need a response right away, email my regular email, taz.frankaroff@eac.edu, if you want immediate response. Okay? For this, especially for this week. I'm gonna be here till like 5 every day, but I don't grade as often at home as I do here at work. So, if you need me, yes.
When's the final?
The final is Monday from 11 to 1, and that's in this room for you guys. If you can't make it during this time, you can come on Wednesday from 11 to 1, and I'll be having the same final done at, in room 308, the big lecture hall where you guys go to human anatomy. And then if you don't want to do either of those, you can do it online, and it does not have to be proctored. So you have 2 hours to do it no matter what way you do it, whether you do it in class or you do it at home online, you have 2 hours. Just remember, if you do it in class, if you have a question, you can raise your hand and I can come over and see what your question is. If you do it at home, then you don't have that luxury. If you have the laptop and you want to do it here, you can, but you still prefer the online format, and you can bring your laptop with you and just log onto the Wi-Fi here if you have access.
What does it do online?
So for online, it will go live on Sunday night at 12 a.m., meaning Monday morning at 12 a.m. And it will shut down the night of, is it the 4th? I mean, the 7th? 7th at 11:59. So Thursday night at 11:59 it closes.
If I have to work both those times for the in-class ones, can I schedule a different time to go do it with you in your office?
I'm so glad you brought that up. If you need to do it at a different time other than what I'm available, you can make scheduled times with me throughout the week to where you can come take it in the office.
Starting Monday, right?
Starting Monday. I do not give early finals. Okay?
All my finals are on Monday, so it's
Lucky day.
Monday's my last day of school.
I think all mine are due by Wednesday. Last year I had a final at the last possible time available on Thursday.
I had one on
So
Friday.
this semester I have it all early, so I'm glad. Okay, you guys are free to go. Make sure you ask questions if you have any.